Imagine not being able to open your mouth or even smile. That's what skin cancer did to one local man, this man you're seeing right here, and he couldn't do anything about it because he didn't have the money, he didn't have health insurance. Tonight, though, after surgery this morning, we're happy to report he is able to smile again. Now, the man who performed the procedure, plastic surgeon Dr. Richard Ellenbogen, joins us in studio tonight.
Very good. Thank you.
It's always a test out here. Congratulations.
Thank you so much.
So it went well?
Yeah, this is a pleasure. This poor guy, what happens to a lot of people who don't have health insurance and they have skin cancers, they don't have a pathologist they can send a specimen to. That's another $300 or $400. So these doctors just take out a big piece. And what they did to this guy, he had multiple skin cancers. They took out the corner of his mouth and just basically sewed it together to get rid of the cancer. And what I had to do, usually restoring the corner of the mouth is a very difficult procedure, moving things around. I did a very simple procedure on him. And the other thing we did is, because he had a dent in his face, we took some fat and we injected some fat, which is one of the newer procedures we use now in facelifts and enlarging lips and creating cheekbones. And we use this in a reconstructive type of way to allow him to open his mouth and still to look normal and to be able to smile again.
And they initially took all of that just to make sure they got everything. It was more preventative than it was.
Exactly. In that situation where you have a skin cancer and you don't have the benefit of taking a biopsy or see how far the cancer went, these doctors take a really big piece. And they do this to a lot of the people who don't have insurance. They can't go to Cedars or UCLA or
and here's our gentleman right here. So you did the surgery. Can he actually move his mouth now, or will it be a couple weeks before you see?
No, actually, he can.
I see you smiling there.
I believe in doing things without making a big fuss about it. I don't try to do something that's an overly large operation. I did a very, very simple operation to allow him to open his mouth. He can open his mouth now. He can smile. He was very disabled. He couldn't talk. He couldn't eat. He couldn't chew. His lip used to go into his mouth when he'd chew, and he'd bite on it. So in other words, I did a little procedure that you usually do on children who bite an electrical cord and they lose the corner of their mouth, rather than a cancer type of operation. And he did very, very well in the operation. It only took me about an hour and a half. And I was able to do this more simple operation because I had the benefit of taking some fat of his fat with a needle and injecting this fat, which is like the consistency of honey, to build out the depression that it made in his jaw. This
is so amazing to watch. And you say this will really transform his life?
Well, his daughter called us up in the afternoon. She says, I haven't seen him this happy in 15 years. So I guess it did. He was very pleased to do this. I mean,
you know, a lot of people think about smiling and they think, you know, you've got your life, what's a smile? But it was really important for him.
It was more because you get the impression, if somebody can't smile, that they're grumpy, that they're... One of the things we do is something called expressional surgery. When people's brows are down, we lift up their brows. If their mouths turn down, looking younger is not just getting rid of the jowls and getting rid of the folds in the face. It's improving the expression. And this is what I did with him, where he had this mouth that turned down. It totally changed the way he looks. And when you look at yourself in the mirror, you act like you're...
What you said, too, earlier. He's a cab driver, so... Anybody approaching him to get in a cab might form an impression by the look on his face.
Exactly, and he's an immigrant. He speaks Romanian. He doesn't speak very good English, and people get in his cab because his mouth is closed. He can't speak very well, and people get out without paying him. And it really just affected his whole life, and I'm glad that we could do something where even tomorrow he'll be able to eat and get in the shower and do everything.
We talk about the fact that he doesn't have health insurance. What possesses someone like you to step up and help out like this?
Well, I've been doing this for a long time. For a while, I had a little clinic in Mexico where I do children with cleft palate, cleft lip. You know, I'm glad to do this. It makes me feel good. It balances me. You know, I've been in practice in Beverly Hills for 35 years. You know, my list of clients, you know, could be like a list of people on the red carpet. But to do those and to do something like this, it makes you feel wonderful because you have the power to be able to make certain people happy. and to change their lives. And, you know, I mean, nobody can pay me for that. The gratitude and the fun that I get out of doing it is beyond any payment I could ever get. So it's something that I do when I can find people who I can help.
If someone is watching this and they know someone like your recent patient, or they're in the same sort of situation, how do they find out about someone like you?
Well, to be very frank with you, I did this. This was a friend of my wife's.
A friend of a friend of a
friend of a friend. This was my wife's manicurist. Told her about the story about her father, and I did this. I'm not set up now in a Beverly Hills clinic to do some of this stuff, but there are clinics at UCLA. There's a clinic at USC. Most of the big hospitals where they have residency programs and training doctor programs will have charity plastic surgery clinics which will do this type of stuff.
Well, thank you so much for coming in.
Thank you for having me.
I can't wait to see a picture of him smiling.
He's smiling already.
All right. Thanks again.
Thank you.